Good morning. I see we have 4 classes out here, which is excellent. We appreciate you all being here this morning. I'm Kate Lee. I am the Executive Director of Education and Workforce for the South Bend Regional Chamber. That South Bend Regional Chamber box you see is actually Allison Hersig, who's hiding back there and doing all the magic behind the scenes and checking the chat and dropping in links. So I thank her for that. She's also the one that figured out the timing of all these sessions and who's going to be where when, because she is a logistics marvel. So she gets to do all that great stuff. So we appreciate her. Quick housekeeping. Thank you for being a part of Health Careers Week 2022. All attendees are muted, but we still want to hear from you. So please use the chat to ask any questions or share comments. This session is scheduled for 30 minutes. And as a reminder, panels are being recorded for year-round career exploration. So if you have friends who missed this or you want to go back and see anything, they will be on the Health Careers Week landing page on the Chamber website after the week is over. So we want to thank and recognize the support of the South Bend Clinic, the premier sponsor of Health Careers Week. We appreciate their support in organizing this and getting it all together and finding us a great person to share information with you today. Please visit the Health Careers Week landing page to learn more about businesses and careers in healthcare. So we are excited to welcome Patricia. I'm going to get this Scheibel. I should have asked you this before. Scheibel.
Oh, Scheibel.
Scheibel. Potato, Scheibel.
Right.
And do you go by Patty or Patricia?
Patty is fine.
Okay, Patty. Executive Director of Imaging Services for the South Bend Clinic and possibly other titles in there as well that I'm sure she'll share with you. I'm just going to ask questions and have you hop in. And I wasn't sure, I never got to ask this question before we went live. Is there somebody else with you? There was going to be possibly a radiologic technician.
A radiologic technologist was to be with us. And I can refer to that technologist in a little bit too, but we were short staffed. We had someone call off sick today. So that's kind of part of the field to be able to provide healthcare services to our community. We have to move on the fly. So we don't have someone with, but I have quite a bit of years experience and not too long ago. So I still remember some things.
And it's great. I mean, this is a great illustration of like why healthcare careers are so important, why we need more students to understand the great opportunities and take advantage of those opportunities, because anybody who's reading anything knows that healthcare, there are staffing issues in healthcare. We need more nurses. We need more everything in healthcare. And there are so many different roles in the healthcare sector and so many different places you can put them to work, from clinics and doctors' offices to hospitals and labs. There's just so many needs. And so we really appreciate you being here to share the South Bend Clinic perspective on all these things. So I will just jump right in with questions and remind the students and educators to drop theirs in the chat if they have any as we go along. So thanks for being here, Patty. And we're going to start with it's no secret that there's a great need for healthcare employees nationally. Let us know what it looks like from the South Bend Clinic perspective and just what you know overall of the health community in our region and what the needs are.
So thank you for having me here today. I always like to talk about our field because I do feel like I think a lot of people recognize in the healthcare field, doctors are very important, nurses are very important, but there's a lot of ancillary avenues that individuals can go, because being a nurse and being a doctor isn't for everyone, but helping in healthcare may still spark interest for individuals. So I know, and it's probably just not in our area. I think it's across the country. There is a shortage. As we all know, the pandemic has greatly affected every profession and even every individual. I know students had to go through some challenges and changes. Teachers did, healthcare, businesses. I think everyone had to relearn kind of how they're going to, what the norm was for them has changed. So there is a huge need in our area for healthcare. We see positions needed for nurses, doctors, but so in radiology specifically, there is, it's not just X-ray imaging, that's kind of the entry, but there's also CT, MRI, ultrasound, nuke med. There's lots of other modalities in imaging, and then there's even some that I can speak too, but we don't have here. But I know that they are within our community, so it is another option. But there is a huge need. I know when I went to school, when I went to my program locally, which I'm sure that'll come up in a little bit, but the year after was kind of a drought. Nobody could get a job. So now, I don't know, as a high school student, I don't know that you really, I wouldn't have paid attention to this information out there now, but it's kind of like supply and demand. So right now, there's not a big supply of healthcare workers, but there's a huge demand. So there's different incentives to be a travel tech. There's money that's attached to that. To just work locally, there's money that's attached to that. So that's a lot of, that wasn't around when I was finishing school. So now I just had a technologist who's fantastic, but she's younger, has no ties to the community here, although she loves it. She loves being at the clinic, but with not having a family and no ties to the community here, she wanted to see the country. So for her to go into being a travel tech was ideal for someone like her, because they pay for a lot. And really, in some instances, you don't have to pay room or board or really anything. And you're able to see other parts of the country that you may not be able to see. So I do think that is a big effect within our community across all healthcare.
So let's dig in a little bit on that particular position. Like, what would be the education requirements? What would students need to do to get to a place where they could take advantage of an opportunity like that?
So students are very fortunate in our area, because I know of two programs right now. I know IUSB has a program, and also, which can be a 2-year program, but then you can transition over to a 4-year and get a bachelor degree if that's something that's of interest. And then there's also in Benton Harbor, Michigan, where I actually went to school, Lake Michigan College. It's a 2-year college, and it's a 2-year program. And you would come out with an associate degree, and that you would start working right away. So there are prerequisites that would need to be taken, but for both entities, I'm sure. The entry level for both of those would be a X-ray tech. And so back to previously, the difference between a technician and a technologist is the years of schooling. So a technician is probably not as common anymore as it used to be, and that's almost like a certification. So it might be like a 6-month program. You don't get the vast knowledge that you do with becoming a technologist. And as a technologist, like I said, you'd have an associate, a 2-year degree after that. So that's kind of the difference between technician and technologist. And then X-ray is, like I said, kind of the entryway into imaging. You don't have to stay there. And that's not the only way. I mean, I recommend individuals going to X-ray first. And then you can branch off into different imaging, such as CT, MRI, ultrasound. You don't have to go into X-ray for those, but I think in the, especially now, it makes an individual more marketable, because they can do other tasks. So they're not just funneled into, they can only take X-ray pictures. Now I can do CT and X-ray, so I can fill a void of, maybe 2 individuals as opposed to just one, and that can help getting a position quicker as well.
And I think and I think we're seeing that like in every industry and field. Like, the more cross-trained you are, the more, I guess, tools you have in your toolkit, the more knowledge you have, the more valuable you are to your employer, because you are able to jump in and fill in and really just get it done when it needs to be done. And employers value that. And it also that lifelong learning potential and for growth, and just knowing that if there's an exit ramp that opens, you're qualified to take it, or all those exits and entrances are more accessible the more knowledge and education you get. So that's really helpful. So let's talk a little bit about how would high school students or students who don't have any background in, maybe they are out of high school, but they didn't take any foundational kind of healthcare classes. But in high school in particular, are there classes that you would recommend them looking at as foundational? I know I always say the basic bricks of education. Obviously, communication is incredibly important in all things healthcare, not just with patients, but also with your fellow team members. So developing those skills. So written communication, verbal communication, being able to understand numbers and that kind of thing. So what foundational classes or kind of extras would you recommend for students?
I mean, those are really the basics, and kind of like you said, for any, just to break into a career. But then I think if you're wanting a healthcare, medical terminology would be a good course to take. I don't know that there's, well, anatomy, physiology, those are probably going to be prerequisites for really anything in healthcare, I would imagine, but definitely speaking specifically to radiology, you would need those courses. And I don't know, I know in some programs, some facilities I've worked at, when I worked at a hospital, I know high schools have kind of, it's like a health, it's almost like an introductory. We would have students come in from a local high school, and they may come in for a day, but they may spend, you know, a couple hours in the ER and a couple hours in radiology and a couple hours in maybe a family practice, just so they could kind of see a glimpse in. So I would recommend that because I think a lot of people for radiology, and myself included, when I went into X-ray, I thought, well, I'm just taking pictures of bones, but that's really not the case. You actually see, as you learn over time, that you can see more of kind of the internal organs with X-ray. You can see the shadowing of it, and it's not just bones. There are other procedures that we do that help. You know, maybe it's called an upper GI. So you have an individual drink some solution, and the radiologist will take them through a series of pictures, but it's kind of cool because you can see the colon and you can see them drink and watch it go down their throat. And so it's kind of neat. It's not just bones.
Yeah. And I think that's where, like, those job shadowing opportunities, we're fortunate to have really great employers in our area who are willing to offer up those opportunities for students. So I'd encourage students, if those opportunities are available, to take advantage of them, because it can really help you think about what you want to be, but it also might help you go, ooh, I definitely don't want to do that because I just saw that, and ooh, that's not what I want to do the rest of my life. So, and that's an important thing to do too. You just need to know what you do want to do. You need to know what you don't want to do. So it helps to rule things out because there's so many options. So that's not bad. So tell us a little bit about your career pathway. So I would say, let's start with young Patty. And what did she want to be when she grew up?
Well.
And then, like, how did you get where you are? And what was your pathway to this career?
Well, and it's funny because I have two high schoolers right now. One is a senior getting ready to graduate. So I have to bring it back to young Patty. And you know, I think everyone's pathway is different. I don't think that there's any pathway that's necessarily better than another. I think it needs to be focused on you as the individual and kind of what's going to work for you. I know when I first went into school, I probably changed my major 4 times. I think I wanted to be, I think like every 12-year-old girl wants to be a veterinarian. So that's what I wanted to do at first, and then realized pretty quick when you get into the in-depth chemistry classes, I realized quick that's not for me. Then I think I switched to accounting. And after one accounting class, I realized those kind of numbers are not for me. Ultimately, I don't even know how I came upon it. I decided that I was going to go into athletic training, which is I very much enjoyed hanging out with high school kids. I think that they're a lot of fun to be around. So athletic training, and I love sports. So my bachelor degree is in athletic training. I'm not originally from this area. I'm actually from Chicagoland area. I grew up in Chicago. So met my husband, who's from Grand Rapids. We moved out here, and he's a teacher also. And so I kind of got involved with, worked a little bit in physical therapy, and I was doing some athletic training even here at local high schools in the South Bend area. Then decided going to start to have kids. So my path went into that. And as I'm sure some on this meeting here could appreciate, high school sports don't really start till 2:30 and they can go till 10 o'clock at night. It makes it really hard when you have a young family. So I did have to start to think, what do I want to do? I considered nursing. I think being a nurse takes a very special individual. And when I looked into that more, I didn't think that I was going to be, I mean, it was something I could have done. I just didn't feel as though that was really my passion, kind of knowing I wanted to impact more individuals in a day than just, having a set group of patients for a certain amount of time. So I had a friend that was in a radiology program in Illinois, and she was about a year ahead of me in the process. And so when she and talked about it, I'm like, that sounds kind of interesting. I started to look around in this area, and I came across Lake Michigan College. That was the best fit for me to fit my life at that point in time. I had two little kids, 2 and 4. So going back to college at that point, and that really helped me, because I'm just going to be totally honest. I was the type of student where I like to have a lot of fun. I was very social. And so once I had kids, I was a huge procrastinator. I still have that a little bit, but once I had kids, it really required me to I had a better focus. And I can say, so the program is 21 months. And the age of our group was anywhere from just out of high school, because I know that some kids now, they have their track is kind of expedites them through college a little bit. I didn't have that when I was younger. So I know, just looking at my kids, they already have a leg up. They've taken some college courses. So the group that came in could have been right out of high school, but then we had ages. I think in my graduating class, there was someone who's 56 who graduated. So we had a quite wide array of aged individuals. I was 30, I think 33 when I graduated from that X-ray program. Worked, you do a clinical rotation, and maybe we can get into the program a little bit more in detail, but started working at local hospitals in Michigan. I did that for probably about 4 years, and then had an opportunity to move into leadership, but still being in patient care. So it was a small hospital, in Dowagiac. I think they've changed their name a few times, but it was Borges Lee Memorial at the time that I was there. And then I felt in leadership, I can take on a little more. I had an opportunity to come to the clinic. And at that time I was managing over radiology and lab. Wasn't really excited about that the first time through, because I didn't know lab, but I knew radiology. Had an opportunity to go to Unity. At that time, it was Unity Physicians.
And surgery center or something like that?
Yeah, medical hospital. They changed their name now. They're Unity.
Everybody just keeps changing their name. Stop it.
I know. Changing the name, changing the logo, changing the colors. But so being there, that's a physician-owned hospital. It's very small. It's over by St. Joe Regional, right around the corner from them. I didn't even know that they existed there. Became a director of radiology there. Physician ownership changed at Unity, And then I found myself back with South Bend Clinic again because they were new physician ownership in there. And they offered me an opportunity of which I'm in today. And I now manage the all the locations for South Bend Clinic imaging, which there's 5 locations, and then also the radiology imaging at the university, Unity Hospital as well.
So you're like a poster child for multiple things. I'm thinking lifelong learning, obviously, the ability to pivot and adjust to life circumstances, because on our first session, we heard from students who were influenced to go into their careers because of health challenges of family members and how that really kind of pivoted them into where they are now, and really listening to what your life is telling you to do. And I always say sometimes you just show up places by accident and you're like, oh, somehow I ended up exactly where I'm supposed to be. So that's a great thing. So, and to never burn bridges, because clearly you were able to go back to South Bend Clinic. So that's another good piece of advice for students. When you do have that first job, no matter where you're working, it can all come back to circle back to you. So it's always good to put your best foot forward everywhere you go, be reliable, be the person people can count on, and show that you're willing to learn and move into different things is a gift. So thanks so much for that story. So I see in the chat, we have a question about internship opportunities for high school students at the South Bend Clinic. Are there opportunities?
So we do allow for a job shadow, I encourage students to come in. We don't have anything set. HR, of course, there's paperwork, there's HIPAA paperwork that would have to be signed. And then there's also a degree of we have to ask the patient, because as a patient, you have rights. And so we actually have Lake Michigan College students that do clinical rotations with us. And there's parameters they have to follow, but at the high school level, we are open to letting students come in. I just can't guarantee, if a patient is going to allow you to be within their exam per se, but definitely there is opportunity. I can give my information to you guys if you wanted to pass that along to individuals.
That'd be wonderful. Thank you. So what was your first job? I always say to high school students, we do have this kind of obsession with being on your pathway and being ready to go. But I found that some of my first jobs, like babysitting, giving swimming lessons, and working at the Dairy Queen, there are some foundational skills I learned there that have served me no matter where I landed in a job. So what was your first job?
I would say I was fortunate to know a family when I was younger. I started babysitting for them when I was 12. And over the years into college, I kind of became their nanny. But at 16, my first job was at a veterinary clinic cleaning out animal cages, which no one's really excited about, but because I had that dream of wanting to be a veterinarian, so I had started there.
And see that's an example of like somebody has to do it. And nobody wants to work with people who are like, that's not my job, because somebody has to do everything. So I think you probably learned something incredibly valuable there. Did you work then when you were in college?
I worked various jobs through college, a lot of restaurant jobs, just because at that time it was quick money and I didn't have to spend a whole day doing it per se, unless I wanted to. Your shifts could be 4 hours and then I still had time to do my schoolwork or go to class, and I could work in between that.
We did have a question regarding field trips, and I'm just going to guess this based on my healthcare experience. A group of students could be an issue because of HIPAA. This is where healthcare makes it really challenging, because patient rights are, all of us sign those forms every time we go in. And if you're a student and your parent has signed it for you, trust me, someday you'll be going, okay, tell anybody about anything, whatever.
Yeah.
So field trips, could you make that work, or would that just be better one-on-one?
It depends. During the normal business hours of when you all are probably in school, probably not. But I don't know if the schools would be, I don't know if they allow for any type of a field trip, on a weekend or a later hours, or, maybe when one of our facilities is not seeing patients within the imaging area. I'm happy to kind of introduce the students to, to see a CT unit up and close, to talk about an MRI unit up close. So yeah, I'd be open to that.
And that could be really interesting to have like a behind the scenes at the South Bend Clinic event where you could go from department to department and kind of see different things, have staff talk about the jobs they do. Could be a great opportunity. So we'll add that to our list of things to do. That'd be a great thing to put. So within the South Bend Clinic for you, what does a typical day look like? And for you and just in general, like the highest demand jobs, like if you were to say, here's a great way to get your foot in the door right now, there's a big need. So that's a two-parter. Typical day for you, what would you say to students if you're interested in getting the education that will get you to work the fastest? Like, where would you go with that?
So typical day for me, which is probably going to be totally boring to all of you, is kind of the planning for, for future and growth. What can we bring to the community for imaging? I know the South Bend Clinic, we really try to keep our costs to the patients low. And in hospitals, they have, a lot more, they're larger, they definitely can offer a lot more than the clinic does, and as they should. That's where patients, tend to go when they're not well. The clinic, we want to try to bring as much as we can in an outpatient setting to our community, because some people are petrified of going to hospitals and they don't want to go there. So, or I know I have family members, because we are multi-specialty, they might see a cardiologist, an internal medicine doctor, and their family doctor. And, if they have to go to an ear, nose, and throat doctor for anything, they can come to one place, one organization, and they feel comfortable with that. So my role is kind of keeping at a higher level what's going on in the day-to-day. I do have a manager below me that's more embedded in the department of the day-to-day, and then there's some supervisors as well. But I guess I would say that my role primarily in the day-to-day is looking at the growth and what we can bring to the clinic and the community.
Excellent. So, and that's something for students. Like now that if you take a look at the South Bend Clinic logo, you'll notice that you see that not just on the South Bend Clinic on Eddy Street, but you'll see it in different offices around, and there's different locations. My dermatologist is on the south side. So it's like, you never know where you're going to find people.
Yeah.
And that's a good thing to remember. And so as far as roles for students to really be considering, and where is there opportunities for growth, and like, how should they prepare? What's a great first job and way to move into, particularly in obviously the radiology department?
I mean, and in healthcare, I believe a lot that you said earlier. Every job is important. Every job in an organization is super important. From, someone who might clean the areas in which that you have workers, because we want, we want it to look nice. We want the patients, when they come in, to feel that it's, clean. Individuals, we have concierge that they kind of guide. You guys might think of them as a Walmart greeter, but they, when patients come in and they see this huge building and they're like, I have to go here and I have no idea where it is. So these individuals will take patients to their destination. I'm just trying to think as an entry level, as a high school student now, just to kind of get your foot in the door. I mean, no matter what role you want to take, and whatever you think now, this is what I want to be. And that doesn't mean you won't change. I encourage you to go out and look to see what, reach out to those companies. If they see that you're ambitious and want to get involved now, and see kind of that determination, you may get no as your answer first, but the fact that you reached out to them and inquired, it may be a yes next time. So that's kind of how you're going to create your path. So, entering into a facility like the South Bend Clinic, there's, front desk staff that we have checking patients in. There's phlebotomy work. You can get into lab. I think that is a 6-week program. I'm not sure. I know Ivy Tech offers something of that. That's a quick program that will get you in. I've had people who maybe started out as phlebotomy and then they decide they want to go into x-ray. And so then they go into x-ray and then they decide, well, gosh, I really want to get into CT. And so then that phlebotomy work helps them in CT because they're going to have to do some of the procedures and injections with contrast. So yeah, MAs I know are a real need right now, especially at the clinic, throughout the whole clinic. And again, that's another program. One thing that the clinic does offer right now is just because there is such a high demand for MAs is
Medical assistant.
Medical assistant, sorry.
That's okay, just in case somebody doesn't know.
Yeah, so they pay for your learning for it. So I had someone who started in as a person who checked someone in at the front desk. She used to work for a veterinarian, answering phones for them. And we offered an MA program here, and it kind of takes you through the learning. It was all online, and she graduated that. She passed her testing for that, and she's now a medical assistant for one of the doctors within the clinic. So I would think as a high school student, that might be some of the pathways for immediate.
Yeah, and Marcia did drop in the chat, Marcia Mimolenti, who is with South Bend Clinic in HR, dropped that we will be talking to that very person you're talking about. Her name's Katie this afternoon in our last chat of the day. So
well, there you go. So
way to tie that all together, Patty.
I didn't even know that Katie was going to be there. So
woohoo! So our time is up, which saddens me because this has been a great conversation. And I think the takeaway is like the opportunities are unlimited in healthcare. And just like in every other industry, there are jobs that don't even exist today that may exist by the time you got out of high school or college or 5 years from now. So to just kind of keep your options open and keep learning. Yeah. So thank you so much to Patty for being here, to the educators and students for joining us today. As a reminder, all sessions are being recorded and will be available on the Health Careers Week landing page for continued career exploration. And also please visit the Health Careers business directory on the Chamber website to learn about the South Bend Clinic, the many job opportunities they offer, and explore the pathway pages for detailed information about careers. And those include salary, job growth, responsibilities, and education requirements. So thank you so much again, Patty. We appreciate you being here this afternoon. And we will probably be sharing your information with some of the educators on here to maybe connect, and we'll come up with this behind the scenes tour of the South Bend.
Yeah.
Thank you very much.
Yes,
have a great day.
Bye-bye.
Bye.